Hello, my name is Alexandra and welcome to our lesson on health. There are a number of factors directly influencing health. We not only have those related to genetic disposition, but also those depending on the social and natural environments. The first factor, the air we breathe. Needless to say, it should be clean and free of pollutants, or at least not surpassing health requirements. Secondly, we have the water we drink. It must be safe to reach and clean of toxic pollutants, bacteria and parasites. Closely related to the water we drink, we have the water we need to wash ourselves and our clothes. Basic hygiene is necessary to prevent illnesses from breaking out and spreading. Sufficient and healthy food is the third factor. Malnutrition and famine are consequences of an insufficient food supply. For child development, a balanced diet is essential. We also have the factor of a secure shelter, which provides protection from the elements such as rain or cold, as well as the feeling of security which is necessary for a healthy psyche. Lastly, the factor of safety. It is a broad term, but in this instance we understand it as a safe environment outside of the secure shelter. This can include political stability, a healthy social environment, and a safe place to work. In other words, conditions that do not endanger one's health. So let's now review these factors in depth and how climate change influences them. Firstly, clean air. According to the US National Climate Assessment, climate change will increase ground level ozone and/or particulate matter air pollution in some areas. Increasing temperatures and irregular rains can lead to more frequent and larger forest fires, setting free a huge amount of pollutants. Thus, it is not hard to imagine that polluted air will mostly affect the lungs and the general respiratory tract. Diminished lung function, increased severity of asthma, and lung cancer are some of the possible consequences. Apart from that, other so-called non-communicable diseases can be triggered by air pollution. Among them, we can consider cardiovascular diseases and cancer, especially the skin and gastrointestinal types. According to the World Health Organization, the WHO, non-communicable diseases are responsible for 71% of deaths globally every year, and more than a third of them occur to people under the age of 70 years. Then we have the factor of safe and clean water. It is kind of obvious why clean water is so important. Dirty water can lead to health problems in the form of diarrhea, poisoning by chemicals or heavy metals, and spreading of parasites like intestinal worms, not even speaking of dehydration. Proper hygiene is essential in stopping transmittable diseases and the contamination by feces-related diseases. But what is the connection to climate change? There are direct consequences, such as droughts leading to a lack of water. And when clean water runs out, dirty water is being used for drinking and cooking. There are a lot of more complex relations though. One of them is the irregular rainfall and extreme weather. While the ground runs dry during periods of no rain, when there is a heavy downpour, water gets easily polluted. The hard and dry ground impedes water from seeping in and leads to fast-running floods. This can then carry a lot of pollutants, not only particles, but also fertilizers, pesticides, animal waste, and when overwhelming sewage systems, even fecal matter. Another factor relates to the rising temperatures, which make many water bodies become warmer. This condition makes these warmer water bodies more attractive breeding grounds of germs. Lastly, as water sources decline, the formerly diluted contaminants such as germs, but also chemical toxins, fertilizers and heavy metals become more concentrated. Higher dosage affect human health more easily. Climate change has various impacts related to the global food supply. First of all, a less frequent rainfall and rising temperatures can lead to water scarcity. and thus to a lack of water for irrigation in certain regions. Secondly, invasive species, like pests, can be destructive to agricultural practices. New climatic conditions require new assortment of crops in the affected areas, while unpredictable weathers lead to crop failures. These problems lead to the issue of food security, and as such to food access. Without it, malnutrition ensues. The definition of malnutrition includes both overweight and undernutrition. The latter mostly occurs in low and middle income countries, and according to the WHO, around 45% of deaths among children under 5 years of age are linked to undernutrition. Children are most affected not only because of their vulnerability, but also because of their need for proper nutrients to develop healthily. Brain and physical development are tied to a healthy diet, and mental health is another factor that is often disregarded. Especially in the light of a globally rising population and decreasing fertile soils, the prospect of sufficient food is haunting. As to the factor of overall safety, let's consider the direct and indirect influences of global warming, and we will see that the most direct impacts on health are heat-related illnesses. Not only can heat cause cramps and exhaustion, but upon longer exposition, a heat stroke can occur, threatening vital organs like the brain, heart or lungs, among others. Further direct impacts are accidents caused by the extreme weather events like floods and storms. Falling trees, flying debris, and rushing water can also take lives. The system can prevent damage from happening in multiple ways, though. Providing preventive measures against floods or cooling infrastructure are just some examples. A reliant health system is essential for overall safety. However, all these points are cost-intensive, and therefore less developed countries are more vulnerable in general. There are also indirect impacts like the spread of zoonotic diseases. For example, the hantavirus that is transmitted by rodents or vector-borne diseases. Zoonotic diseases are those which are initially transmitted among animals but have come to befall humans, such as in the case of COVID-19. While there is no evidence of a connection between the COVID virus and climate change, global warming is spreading zoonotic diseases in general. Then vector-borne diseases, which are also among the zoonotic diseases, but that get transmitted by a vector. Vectors work like this. Say there is a human or animal carrying the disease and it gets stung or bitten by the vector. When this very same vector bites or stings another human afterwards, there is a high chance of them catching this disease as well. Malaria, dengue, yellow fever, and Zika are transmitted by specific mosquitoes as their vectors, while encephalitis is typical for tick bites. According to the WHO, more than 700,000 people die every year because of vector-borne diseases, and at least 400,000 of them because of malaria. Before we explain the climate impact on zoonotic diseases in more detail on the next slide, let it be said that the mental toll all of these health impacts have on human population is immense. At the same time, secondary impacts like political instability and the loss of income in relation to climate change can put additional pressure on mental health. So let's tackle zoonotic diseases and start with malaria. It has the biggest impact of them all, with over 400,000 deaths per year. In 2019, the WHO estimated around 229 million cases worldwide. Malaria is a parasitic disease caused by Plasmodium single-cell organisms and transmitted by the Anopheline mosquito, mostly human to human. After being stung by an infected mosquito, the poor victim will serve as a host to the Plasmodium parasite, which in turn infects the liver. After a couple of days, the infection will spread to the red blood cells, and from here onwards, hot stages with extreme fever begin and can lead to death if not treated. Previously, there was no malaria vaccine, but in 2019 a new product started its pilot phase. The vaccine RTSS is designed to prevent the infection of liver cells, especially in young children. The difficulty of getting malaria vaccines lies in different factors. First of all, the parasitic disease is a very different matter than a virus and must use different technology. Another important point is that the population that is primarily affected by malaria is mostly part of the developing world and thus doesn't have the financial resources to back up a lot of research on the topic. There are a number of ways in which climate change can affect the spreading of zoonotic diseases. First of all, there is the potential for more vector breeding sites in many areas. More rain can offer them small water bodies to lay their eggs in, and droughts could lead to humans storing more water in provision. Many vectors are arthropods. They are ectotherm, which means that they don't heat up their bodies by themselves, but depend on the temperature of their environment instead. This also signifies that they are highly susceptible to temperature changes. Global warming, including higher temperatures of water and air, can not only lead to the spreading of vectors in previously colder regions, but also to a higher vector activity. Other zoonotic diseases that are not vector-borne are also increasing with climate change. Many animals migrate to more habitable areas due to climate change. Species that might otherwise have stayed apart come to meet, and these contacts can lead to spreading of viruses. Additionally, when climate change alters their habitat situation, many animals might seek shelter in human settlements. In Sweden, there is an example where the hantavirus had a significant impact in 2007. It was the same year in which a warmer climate prevented a protective snow coverage for the disease-carrying bank wall. At the same time, Swedish residents reported more bank walls trapped in house traps than usual. With a higher exposition to infected rodent excrements, the infection rate in humans rose. Now back to the factor referring to a secure shelter. In combination with lack of secure shelter, climate change impacts health on multiple levels at once. While we have seen the various effects it can have on health, on its own, it can exacerbate the situation by exposing people even more to the aforementioned issues due to lack of shelter. Floods and storms might destroy housing, and the consequences of climate change can make living in certain areas difficult to impossible. Furthermore, the ensuing migration poses a threat to health in so many ways. For instance, just think of the terrible condition in the refugee camp on Lesbos, Greece, or the humans freezing in forests in front of the Polish border during European winter. Also, death by drowning is not a rare occurrence in the Mediterranean for refugees seeking to come to Europe. If you want to know more about that, we have included 2 articles in the recommended reading section at the end of this lesson. All the aforementioned risks are only the most general ones. There are so many specific ones that we cannot name them all. Say, for example, the increased exposition of farmers to pesticides due to invasive species control. The most vulnerable people to climate change impacts are children and elderly people, inhabitants of developing countries, and the homeless all over the world. We have already explained the situation of homeless people being exposed to heat, cold, bad weather, and other risks, such as diseases. Children and elderly people are vulnerable since their immune system is not as well developed or any longer strong, respectively, as that of middle-aged adults, and also because they often cannot care for themselves. People in developing countries run more risks due to infrastructural conditions, as well as the weaker health system. Often, Women are particularly vulnerable because of patriarchal systems. Another important factor to mention is that most of the developing countries are situated around the equator, where climate change will strike the hardest in form of desertification and droughts. The most fundamental solution to protect our health from climate change is to mitigate global warming to the least increase in temperature possible. There is a huge list of mitigation measures, starting with energy production from renewable sources and sustainable transport, the reduction of consumption in general and of greenhouse gases in particular, to land use changes and so many other factors climate change relates to. Since at the current point in time, it doesn't seem like we will manage to keep to the 1.5 degrees Celsius goal we were aiming for, and in fact, we can already feel the impacts of climate change in various ways, today, mitigation will not be enough to protect us from the crisis in front of us. Adaptation measures must be taken. Some examples are protective infrastructure against floods, like dams and water retention areas, enhanced water and wastewater management, or modern agricultural techniques, which not only yield more harvest, but also preserve soil quality. Reduction of food waste could go a long way to feeding the world population, while greening infrastructure can help with water preservation, as well as have cooling effects on settlements when integrated. Extensive farming can help protect biotopes, but is at the same time less productive than traditional farming. Awareness for climate topic must be raised globally, and policymakers must be convinced to pass new laws on adaptation and mitigation. To withstand the challenges in front of us, it would be of great advantage to develop and improve health systems and health infrastructure to a greater coverage. This list is far from complete, but it can give you an insight in some of the possible measures to prevent climate change from striking humanity too hard. And as to zoonotic diseases, COVID-19 has kept us all on our toes since its global outbreak in the beginning of 2020. It is one symptom of the globalized world, where people can travel from one end of the planet to the other in the span of a day. While this increased contact between people accelerates the spreading of diseases drastically, globalization also offers a lot of potential. Research has never been as fast as today due to global working groups and endless information on the internet. If there is a relation between COVID-19 and climate change, it cannot be said for sure. But as we have already covered in this lesson, there is a link to zoonotic diseases in general. We have seen in the last 2 years that health systems all over the world are in fact not prepared for the outbreak of diseases like coronavirus. There is a long way to go to withstand further occurrences like this one. It must be in all of our interest to prevent another pandemic from happening. For this, exposure to wildlife should be kept to a minimum. The spreading of civilization into natural territory, in contrast, decreases the distance to wild animals, facilitating the infection with zoonotic diseases. A few steps to prevent them in the future would be preserve wildlife habitats, dismantle illegal wildlife trading, and initiate change in policy making in regard to biodiversity conservation and public health planning. Let's not pass this lesson without learning from our mistakes. So, have a look at the recommended reading materials and see you in the next lesson.